Welcome everyone. So Dr. Kamal sir would be talking about converting an unhappy to a happy patient. How to wow. हाँ sir, आपका second. हाँ.
So, am I audible? Okay. So, the most difficult thing is, you see, one thing is converting a complication to a normal situation and doing the surgery. नहीं पकड़ रहा, आपके वायर में इशू है. So, when you are in a medical college, you are taught that if you have a complication, how to manage it. But an unhappy patient is a huge complication. And sometimes this complication is without a reason. You cannot fathom, you cannot find out what is the reason for this unhappy patient. Sometimes the patient is so unhappy that the doctor himself becomes unhappy. The whole environment in the clinic can become unhappy. And this one unhappy patient can take away a lot of your practice, a lot of your enthusiasm and excitement. So what are the tricks and tips to manage these unhappy patients? So we are never taught these tricks in our medical college. They give us the skills, they give us the knowledge, they never give us the skill of having a conversation, knowing the science of having a conversation. And unhappiness is a state of mind, and all the students of physics will understand. All the states are interchangeable. A solid can become liquid, a liquid can become gas, and vice versa. So is the mental state. A happy person can become unhappy, and an unhappy patient can become happy. So what is the science behind that? How to deplug a patient from his unhappiness. So these are scenarios. Surgeon is happy, patient is happy. Best case scenario. Surgeon is unhappy, but the patient is happy. You will have so many patients where you think you've not done the best, but the patient is happy. You don't bother. Problem starts when the surgeon is happy, the patient is not happy. The patient has whatever he or you desired, but still the patient is unhappy. The worst is that the surgeon is also unhappy and the patient is also unhappy. Now this is a condition which will spiral out. These are situations which can lead to medico-legal problems and conflicts. So as the Darwin says, that the survival of the fittest. So when he talked about fittest was not the strongest, the fastest or the most intelligent. Fittest was the one who adapts the best. So in today's scenario, we need to adapt to our patients' aspirations and ambitions. So the changing trends are, patient wants visual aspirational correction, he wants to be delighted, and also complaint redressal. Even if the patient comes to you after a good surgery, 6-6, and he says, I think the floor in your clinic is not clean, the complaint has to be redressed. It is a genuine complaint. So all the beginners in practice may think, कि Dr. Kamal ये क्या बोल रहे हैं? You can do a very good surgery, but if the patient, there is something which irritates the patient, that's worth looking into and correcting it, because this will help you increase your practice. Unhappiness is multi-layered. It is never single thing. Let me tell you, unhappiness is the multi-layered issue. You will never have a patient who's just unhappy because he touched 6-9. The patient is probably unhappy because you kept him waiting. The patient is unhappy because probably he misunderstood the surgical promise and something else has landed. The patient could be unhappy maybe because there are some extra charges in the bill. And then the unhappiness cycle starts. Then he will start finding faults. मेरे आँख में दर्द हो रहा है, मेरे को ये पानी आ रहा है, and then the surgery will become faulty. So these are multi-layered. Sometimes it could be as simple as he didn't think that he got enough time. So if you're not able to give the patient enough time, this could start the season of unhappiness. So a lot of surgeons will just probably talk to a patient for 1 minute and then book him for a surgery. But sometimes there are some patients who want more. They want to be heard. So you have to see the patient who wants to be heard. Now such patients can be caught that they want to share other symptoms. They might want to share their medical history of uric acid medication or their arthritis. Listen to them. There might be patients who are very okay with you advising them surgery after 1 minute of consultation. But a patient who wants to give history, the first sign is listen to this patient. He wants to talk, he wants to share. If you listen to this patient, he will think you've given him enough time. Attention to the patient and the details. Suppose he's mentioned that he is allergic to some medication. Make sure you let the patient know you've heard it and noted it down. That makes the patient feel heard. That makes the patient feel attended to. Surgical outcomes. Make sure that you tell the right outcome. Do not overpromise. Now, these are few things you do before your surgery, which will ensure that the patient is not unhappy. Sometimes it is a missed communication. Like in this cartoon, the man says, the laptop doesn't fit in my lap. So similarly, it could be that you're doing a monofocal lens, but somebody forgot to tell him that the near vision is not going to be there. And after surgery, you tell him the patient is going to be unhappy. So, right communication in the right words at the right time. Behavior of the staff. Suppose the patient, your front desk has not talked to the patient properly. Your front desk or your reception people have not talked to the patient properly. The unhappy cycle has already started. And now on top of that, he's seen the next person saying, "Mere ko to paas ka dikhta hai." Now it is the firecracker. He's already upset about something and he feels he's been cheated. So clear-cut communication of the outcomes of the surgery is must. So I ensure a bare minimum of at least 3 to 6 minutes of chair time with each patient. Patient has waited 1 hour, 1.5 hours to see you. He's probably driven in a big city like Delhi 1.5 hours to see you. And if you cannot give him enough time, you are not doing justice. This kind of practice will not stay for long where you just give very small time to the patient. For that, you need to be a very, very senior surgeon to be able to do that. But then your staff should be taking care of the other part of the time to let the patient know that something is going fine. The patient is non-responsive to the treatment and you have not communicated. A patient post-cataract surgery complaining of a dry eye due to a substandard medication which is just picked up from the chemist and using, and your surgery will be blamed for that. So you need to spend time with the patient and tell them that there is nothing wrong with the surgery. A lot of times a simple question to the patient will solve the problem. Patient will say, "Doctor Sahab, aapne cataract surgery kiya tha, aankh theek nahi bani. The surgery is not well." Statement given. Ask him, what exactly is the problem? Do not lose temper. Do not react. You ask him ki, "Sir, I understand your experience is, aapko lagta hai aankh ki surgery mein problem hai. Can you tell me aapko problem kya hai?" And then he'll say, "aankh jhapakta hu to radak hoti hai." So if you explain the patient, ye radak kyun ho rahi hai, ki incision hai, incision ki healing hoti hai, dry eye hota hai medication se, preservative based allergy hoti hai, and this will go on with time. This will take care. So spending time. So bottom line is, most of the unhappy patients are not wanting to be unhappy forever. Nobody wants to stay unhappy. You agree with me? Raise your hands. Who wants to stay unhappy? Everybody wants to be happy. So if you have an unhappy patient, he's looking to be happy. There are only less than 1% of patients who by nature are fault finders. They will keep pursuing you. But the other 99% patients want to be happy. All you need to do is listen to them. So in our practice at Sharpsight, most of our doctors are trained to deal with these unhappy patients. And suppose they get a very nasty patient, they are probably sent to some senior doctors in the team. A lot of time when they come to me is, all I do is I change my approach. So you have indicators. Either the body language of the patient will tell you he's unhappy, he'll walk in with a grim face, he will not have an eye contact, he'll pull a chair, sit and probably sit with crossed arms. This is a body language of a patient who is closed. He's closed his communication with the whole team. So always you will have these body language signs, or your staff will tell you कि सर बाहर मिस्टर भसीन बैठे हैं और वो बहुत लड़ाई कर रहे हैं, XY डॉक्टर के चेंबर से लड़ के आए हैं और आपको मिलना चाहते हैं. So you already have a ticker, your flag is on. Do not be angry at the start. Normally क्या होता है, when you are told there's an angry patient, you suddenly become aggressive, you become defensive and offensive. No, be plainer. In fact, actually show the patient that you don't know he's an angry patient. That will lower the energy. बट इफ ये आते साथ बोलोगे अच्छा जी आपको क्या प्रॉब्लम है, आप ऐसे बोल रहे थे बाहर किसी को कि आपका अच्छा नहीं आप हुआ, सो वो इस लेवल पे आया था, आपने उसको ऊपर लेवल पे ले गए. So get him down by saying, okay sir, how can I help you? I am Dr. Kapur. I am here to help you. I believe you wanted to talk to me. How can I help you? So then he'll say, मेरी आँख अच्छी नहीं बनी or whatever. You listen to the whole complaint, and the best trick is after he's finished, repeat the complaint. Let the patient know he's come to a doctor who is listening. So once he says, मेरे आँख में पानी है, रात को चिपक जाती है, लाल होती है, जब से सर्जरी हुई है मैं सो नहीं पाया, then you'll say anything else. He says no. So then you can say, okay, I agree. आपने मुझे बोला आपके आँख में पानी है, आपने बोला रड़कती है, आपने बोला रात में चिपकती है और लाल होती है. Now this patient is yours. He knows you're listening. He knows you've heard every word you've said. Now the anger will come down. Now we'll start suddenly being with the person who realizes that this person is listening. Then you can say, आपने किसी और से opinion लिया है. Most of them will say, हाँ लिया है, and they told me that nothing is wrong. So keep that on the side. Don't say, see, I told you. Or they say, I've seen somebody and he said this, this, this. Then you ask him कि आपका apprehension क्या है, आपका fear क्या है. So before you talk into the patient, empty the patient out. As the saying says, you fill only an empty vessel. You cannot fill a full vessel. उसको बोलो आपका apprehension क्या है. Most of them will say कि मेरे को लगता है मेरी आँख खराब हो जाएगी, मेरी vision चली जाएगी. So once it's complete, then you explain what has happened. This is probably a dry eye, or this is a complication of cataract surgery seen in less than 2% of cases. Suppose you say this is a PC rent, the IOL is there, don't worry, it can happen in the best of hands, and the whole team is there to take care of you. Allay the anxiety one by one, and then address the final question that आपकी vision को नहीं कुछ होगा. The moment you take away the last irritant, the patient becomes happy. So training skills comes from listening. You can be only a good speaker if you listen well. You listen to the patient well, and then you can speak into his listening. Quick thinking. You need to have examples ready with you where you have treated previous such patients. And say, okay, I have so many patients who have some problem like you, dry or something. Don't worry. They all are happy now. So then suddenly the anxiety has gone down. Listen to what is being said. We always react to what we interpret as what is being said. This is the biggest human flaw. Most of us will react to what we think is being said. We need to respond to what is being said. A lot of times when the patient says this has happened, we take offense and we say, okay, मेरी surgery को गड़बड़ बोल दिया इसने, मेरे staff को खराब बोल दिया, मेरी organization को गलत बोल दिया, and we react. No, just listen to what they are saying. Never be in hurry to solve the problem. Even if you want to go to the toilet, don't let the patient know you're in a hurry. Show them that you have all the time to listen to him. Show them patience. If you show them they are in a hurry, they will be more angry. Listen to all the concerns. Now this is a classical example. Sometimes patient's complaint will be very different than what you think it is be. I had a patient, a very senior manager in some corporate house in Gurgaon, operated his mother for 2 diopters astigmatism. I told him to get a toric lens done. He got a toric lens done. Something happened. The astigmatism went to 3.5 post-op. So the man, after with his mother, 3 weeks for my turn of follow-up, came and he said, Dr. Saab, my mother is very happy. So before he walked in, I saw the sheet and I said, oh my God, there's something wrong in the calculation, something has gone wrong. So my mind was already working what I should answer, or should I take for resurgery. But I used this science, listen to the patient. So he said, Dr. Saab, my mother is very unhappy with the patient surgery, and aapne insist kara ke surgery kara diya, and she's very unhappy. So I just asked Mataji, क्या दिक्कत है? She says, सारा दिन रड़कन होती है. तो मेरा concern, toric IOL went out of the window. The complaint was रड़कन. The lady was very okay with 624 vision also. So a lot of times, don't see the obvious. Listen to the complaint. Sometimes patient will have a simple complaint, but we as doctors are trying to look for bigger complaints. Deal with it. How to deal with it? Make sure that never lose temper. If you're feeling angry, excuse from the patient. Tell them, okay, just sit. I need to address to something and I'm going for a glass of water. Come back after 2 minutes. Because when you're angry and the patient is angry, this is a recipe for disaster. Get up from the table. I do this. Sometimes patient gets a little personal about the staff. I just say, okay, sir, abhi aapka baat sun liya hai. I just should be back in next 40 seconds. Ek chota sa main kaam karke aa raha hu. I leave the room, recharge myself, come back. and then deal with the patient. Because a lot of times if your tempers are high and the opposite party's tempers are high, this is a recipe for disaster. Remain calm, resist temptation, never interrupt the patient when he's giving you complaints. Always ensure your staff is always happy around the patient. Listen to the patient very carefully. Sometimes patient will have personal tragedy in the house. Personal elderly people having some sick person at home. So they will be anxious. Sometimes a simple question like saying, I understand your problem, what can I do for you? Classical example, I operated a patient for femto cataract and he had 0.5 diopters of cylinder and 0.5 diopters of sphere. He was eating my life. So I told him, okay, what do you want me to do for you? At 0.5, I'm not going to do bioptics for you. I'll recommend you wear glasses. He said, मेरे को glasses नहीं पहनना, मैंने इसीलिए surgery कराया था. So I heard the whole thing. I gave the choice to him. I said 0.5 pe we don't do LASIK, but if you recommend, I'll do it, but the results will be unpredictable. He explained everything. Then I said, okay, sir, what do you want me to do? Guess what he said? Glasses दे दो. Issue sorted out. मगर अगर मैं उसको defend करता रहता, तो sometimes giving the option to the opposite party lowers their guard. Empathy and reassurance. Have SOPs in your organization for complaint redressal. Make sure a complaint is reported, dotted and documented. Always let the patient know that you want to help them and not defend your position. There should be a flow chart in the organization that who is going to deal with what problem. And at every step, the patient has to be informed that yes, their problem was taken care of. We are working on it. So if the patient knows and he gets a phone call from the organization that this complaint is fixed, your appointment is fixed with the doctor, a lot of times these patients would be happy. Never waste the complaints. Sometimes these complaints will have pearls for you. They will be for improvement of your organization, fixing of problems, documentation. Suppose you feel it's going to get into medical legal, my fellow mates will be talking about it. Document the problem in the sheet. Describe the problem. It's a PC rent, it's an end off, it's a task. Mention it in the file. Because paperwork will never lie. The court will never ask you what you said to the patient or what you did. The court will only see what you wrote down on the prescription. So use these tools of photographs and images to explain to the patient what's happening in the eye. Use animations. We have these slit lamp cameras. A lot of times we show these patients these images. Golden rules. Do not prolong the problem. Suppose there's a PC rent in my hands. I do not wait. I call the patient's relative after the surgery, sit with him, 2 minutes, tell him what happened, what has been done. Vision recovery will be slightly lower. The vision will be slightly less than normal for first few days. Explain everything at that moment rather than wait for the patient to bring up the complaint. Document the complications. Have a patient-centric approach and always advise the patient is still unhappy to take a second opinion. Compassion and be ready to take a re-evaluation. Sometimes you could be wrong. Tell the patient, I'll re-evaluate you. That will tell the patient that you're ready to reconsider the complaint. So, but at the end, don't be a doormat. If the patient is getting very disrespectful to you and you feel is beyond repair, folded hands, tell him that you have held the most you can. Never say, मैं आपको कोर्ट में देख लूँगा. That's asking for trouble. Just say, we have done whatever we can, sir. We are always there for you whenever you need. But for this particular moment, जो हम कर सकते थे, कर सकते हैं. If you want, I can refer you to few of my colleagues. They can see you. Maybe they'll help me find out if I'm missing something. And always keep the door of communication open with the unhappy patient. If you close the door, this can mean bad. Thank you.
Thank you very much, sir, for the insights.